everyone, and welcome to Billing Insights, your favorite podcast for medical billing. My name is Taylor,
And I'm Anita.
and we're your co hosts. Today is a very special day. It is Modifier Monday.
Woo!
So, first, inquiring minds need to know, Anita, what is a modifier?
Very good question. So, a modifier is a 2-digit set of numbers that we put on a claim form that just kind of gives more information about the CPT codes that are being submitted on that claim form. They can be various things from showing that it's a left or right-sided CPT code, or it can show that a different provider is seeing the patient in place of you, or there's something else additionally that could be important informational information.
Right. So, today we're going to be going over two modifiers that get confused quite often. So, we are doing modifier 24 versus 79. Dun dun. So, starting out with modifier 24, what is modifier 24?
So, modifier 24 is defined by Medicare or CMS as an unrelated evaluation and management code performed by the same physician or
Other qualified healthcare professional.
yes. Now, you may be wondering, what is an other qualified healthcare professional?
Well, many different things. It could be a nurse practitioner, a physician's assistant, a physical therapist, any of your mid-levels and others.
Licensed social workers.
Yes.
But there are a list of acceptable other qualified healthcare professionals that you can find on Medicare's website.
Look it up. So, when we say same physician in the definition of modifier 24, I believe it was service by the same physician or other qualified healthcare professional. When we say same physician, it doesn't always have to be Dr. Joe Schmo, and Dr. Joe Schmo did both procedures, or the evaluation and management and the procedure. I'm getting ahead of myself here.
Yes, you are.
That'll make sense to you in about 7 minutes. That'd be great if the timestamp actually matched up that way. But so same physician in that instance actually could mean any physician who is in the same group and has the same specialty. So if you're a neonatologist and the evaluation and management was done by a neonatologist in your group and the procedure was done by you, that still counts and you need this modifier. So when is it appropriate to use modifier 24?
Also, a very good question. So, some of the reasons that might be appropriate are the documentation shows that whatever service you're providing is unrelated to the same procedure that was done that you're in the global period for.
Another one would be if the documentation indicates that the service was exclusively for treatment of the underlying condition and not post-operative care. Kind of the same thing there.
Similar, yes.
If the physician is managing an immunosuppressant therapy, during the post-operative period of a transplant, or the same physician is managing chemotherapy during the post-operative period of a procedure.
Right. So let me explain just a little bit about a post-operative period and what that is so it can make more sense. So each procedure or CPT code that is in the CPT code book has what's called a global period indicator. Now, some of those have a global period indicator of 0. Some have a global period of 10, and some have a global period of 90. So if you have a procedure that's done, and let's look at a hysterectomy. Hysterectomy has a global period of 90 days. So let's say you had the hysterectomy, and then on day 27, still within that global time period, you come in for an evaluation and management code, a sick visit, and they're treating an upper respiratory infection. That's obviously not related to the hysterectomy, and so the provider would put on the CPT code that he's billing, perhaps a 99213, he would put the 2-4 modifier on there showing that this visit is unrelated to the hysterectomy and that he should be allowed to be paid for it, basically, is what that modifier is saying.
Right. Um, Also, if the same diagnosis as the original procedure could be used for the new E&M if the problem occurs at a different anatomical site,
Right.
still appropriate to use modifier 24. Now that kind of wraps up when can we use it.
Totally.
So now the question is, when do we not use modifier
Mm-hmm.
24? So if the E&M is for a surgical complication or infection, then you do not use modifier 24. That is regular follow-up that they expect you to do. Um,
So it's
there you
included.
go. Another one would be removal of sutures. You do not use modifier 24 for that. Again, it's some regular follow-up that they expect you to do. It is included in the payment for the procedure.
Yes. So we have an example all the time in pain management, and we have a procedure. It's a 63650, which is a spinal cord stimulator trial implant. Now, you'll put the trial leads in, and then 3 days later, and I think sometimes now they're stretching that out to 5 days, but regardless, they have to come back in to have these temporary leads pulled out and then the stitches removed. At that point, we don't bill a evaluation and management code per se. So a 99212 or 99213 would not be appropriate with a 24 modifier. What the Medicare would expect is a 99024, which is a post-op visit during the global time period. And Medicare does require that they have those codes sent so that they can see that you're seeing the patient during that global period.
We send it out at a penny because, I mean, you're not getting payment for it, it's
Right.
just reporting it. Um, so if when else do we not use modifier 24? If the surgeon admits a patient to a skilled nursing facility for a condition related to the surgery, do not use modifier 24. If the medical documentation clearly indicates that the E&M is related to the surgery, do not use modifier 24.
Obviously, then it's bundled, it's included, you do not bill extra.
Right. And if it is outside of the post-op period of a procedure, do not use modifier 24.
It wouldn't be needed.
By definition, that's self-explanatory. So now that we're done with modifier 24, let's move on to its cousin, modifier 79. They are not sisters, they are cousins. Uh,
They are similar.
very similar. Um, so, what is modifier 79?
So again, it is very similar. However, it's used to indicate an unrelated procedure. So modifier 24 is used to bill for an unrelated evaluation and management. 79 is an unrelated procedure, still performed by the same physician or other qualified healthcare professional during the postoperative period.
And here's a special little billing tip for you. Modifier 79 is a pricing modifier.
Mhm.
And what that means, whenever you have a pricing modifier, it always takes priority. It is always listed first on the claim with any other non-pricing modifiers following it. So, for example, if you have a locum tenens and you need to use a modifier Q6, the order, if you had to use both on the same claim, would be modifier 24 and then Q6. So remember, pricing modifiers always go first. So when is it appropriate to use modifier 79?
So when something is performed during the postoperative period, where the original surgery has a global period of either 10 or 90 days.
All right. When the procedure is performed by the same physician or other qualified healthcare professional, and it's unrelated to the original surgical procedure. So it looks like the instances here, there's not like a
Hmm.
lot more listed like there is in modifier 24. It's just kind of 79. You won't see as much. because there's a lot of reasons that a patient can come in for an office visit,
Right.
but to get another procedure, it's kind of a little bit
More
more
limited.
limited, narrowed down, straightforward.
Hmm.
So, the one thing I did want to point out is that when you use modifier 79 on a procedure, it does start a whole new global period for that procedure that it's
Hmm.
on. Do you want to kind of elaborate on that? I feel like we.
So let's give an example here back to pain management because that's what I do a lot of. We had a medial branch block that's a 64493, and we did it on the right side. And then 10 days later, they came back in and they had it done on the left side. Now, some insurances will require you to put the 79 modifier on there to show that the right side is not related to the left side. So some do not, but some do. So that might be an instance where you would see it used.
Right. So when should you not use modifier 79? If the procedure performed is related to the initial surgery, don't use it.
Hmm.
Um, if it is placed on procedure codes where they do not have a global period,
Right.
don't use it. And if it is reported on ambulatory surgical center facility services. And Anita, why is that?
So you would use it on the professional side of the services for a patient who was seen in the ASC. So if the physician had a procedure and then came back within the global period for that procedure, the physician would bill the 79 because it would still be in the global period for the physician. However, ASCs are determined to have a global procedure day of 0 because these patients come in and they have their procedure, they go to the recovery room, and then they leave after a couple of hours and they're gone home and discharged. So they don't have a global period on their procedure days for the ASC, so you wouldn't use the 79 unless they came back immediately that same day or within 24 hours.
Right, I was about to say, isn't it technically 24 hours? But yeah, so it would not be used for ASCs.
Mhm.
And that kind of looks like that's it for when you do not use it. There is a another modifier that is kind of similar. Where'd that one for critical care go? Don't we have
FT?
something for critical care?
Yes, we
Yes.
did.
For unrelated critical care, and this is back on the modifier 24 fact sheet. If you did not know, by the way, let me just plug them for a second. Novitas has modifier fact sheets.
They are wonderful, by the way.
It's amazing. You know, you can even kind of see what it looks like. It's just printed off the internet. But they tell you everything that you need to know about each modifier. But if you need a little bit more, couple examples, a little bit of, I don't know, back and forth discussion
Extra
about it,
info. Hmm.
come watch Billing Insights. So for unrelated critical care during the postoperative period, refer to the FT modifier.
Hmm.
If that sounds strange and you haven't heard of it, it's a little foreign to you. It is a newer modifier. It did come out in 2022. So just so you know, that is the modifier you would use for unrelated critical care. And then there is another one, which is return to the operating room or procedure room by same physician after initial procedure for a related condition during the postoperative period. That one would be modifier 78, which if you want us to dive deeper into that one, we can do that at a later date.
Yes.
So again, if you need to know more about modifiers, this is just our first Modifier Monday. We have a
Hmm.
lot that are coming out, and they will all be available on gmslearningacademy.com. That is G as in golf, M as in Mike, S as in Sierra, learningacademy.com. You can find us on YouTube, Facebook, Thinkific, the creators version of Spotify. Um,
We're going to start posting them on our website as well. So,
It will be posted on gmslearningacademy.com. You can also reach out to us with any questions in the comment section, as well as any of the socials I just
mhm.
listed, or at Gateway Medical Solutions, which is the billing company that Anita is the CEO of. So Thank you guys so much for watching. We loved having you here. We really appreciate your support. Don't forget to like, comment, subscribe, and punch that notification bell so you get notified every time a new video comes out. And you can stay up to date in this ever-changing industry as new
Very
policies
much.
come out. You will see all of our new tips and tricks,
Hmm.
and we'll make sure you guys stay up to date. So thank you so much for watching, and
Thank
we
you.
will see you in the next video. Bye.
Bye.